kind of more symptoms. So if it's far enough away from the anal verge, it's much easier to tolerate because then they're not radiating the anal sphincter itself.
Yeah,
that's because that causes a lot of irritation, and people feel like they have to run to the bathroom all the time.
It's the nerves there.
I see.
The sphincter muscle is in that area too. The sphincter muscle that.
Yeah, and so that's obviously right at the bottom. And so from the sound of it, his tumor is about 6 centimeters or so above that. That's what they thought on the scan anyway. So it may be far enough away that you won't get too many of those kinds of side effects, but but they do tend to be cumulative. So toward the end of the treatment,
and you're estimating about 5 weeks. It could be less. It could be more.
No, that's the standard treatment is about 5 weeks.
Okay.
Along with the chemo pill.
Right.
Yeah.
And so the radiation doctor sees you every week during the treatment to make sure things are going okay, make sure no adjustments are needed.
Is that you? No, that's not you.
No, that's the radiation doctors
Okay.
we'd have you see are over at Grossmont. So it'd be either Dr. DeWitt or Dr. Ewell.
Okay.
So they would see you every week during the treatment, making sure everything's going okay, managing any problems from their end. And then I usually see my patients every 2 weeks to see if we need to be doing anything different with the chemo pills. And if you start to struggle with the combination, then I have a pretty low threshold to drop out the chemo pill because the radiation is really the more important part of that initial treatment. So we want to make sure you can finish that.
Okay.
And what are the most common side effects from the radiation?
Just what I was talking about.
Oh, okay, you already said irritation,
so mostly
burn
like
on the
diarrhea,
skin, irritation,
so
burning.
diarrhea, a little bit of fatigue, possibly some cramping. You get more cramping if the small bowel is in the field. So, so with this, it may just be a little bit of loose stool and possibly kind of a urgency to go to the bathroom.
Okay.
Yeah, we don't get too much nausea with radiation to the colon. The chemo pills that I'm giving.
Upset the stomach?
Not too bad, actually. Yeah, most patients don't really get stomach upset from this. At higher doses, we sometimes get something called hand-foot syndrome, which is where you get kind of redness, peeling on the hands and feet.
Okay.
Usually, it's kind of funny. It's pretty manageable, though, and so we just decrease the dose, and people do just fine with it. The dose that we give with radiation is usually not high enough to cause a lot of those side effects. It's there just to be chemosensitizing, so it's a smaller dose than what we use when we're using Xeloda by itself to treat. So if anything, occasionally patients will get some diarrhea from the Xeloda, but that would probably be about the only thing I would expect.
From the chemo?
From the chemo at the doses that we're doing.
Okay. And so I did have one more thing I wanted to bring back up. So when we were talking about like this idea of I've been living with this for we don't know how long, and I've been fine. But it seems like you might have been suggesting that this is just from the last year.
Yeah, it hasn't been there for that long.
So, that was my point too, because I thought, sure,
Yeah,
it's not like we've been living with this for 10 years and just didn't know.
No.
It's more like this is an onset from just probably within a year.
Probably, yeah. Yeah, the colon polyp that gave rise to it has possibly been in there for 3 to 5 years or longer.
Okay.
But it probably just became a cancer within the last year-ish.
Okay. That's good information to know.
They call them polyps. They're little like.
She said there are more in there that appear to be cancerous.
No,
we're going to attack one of them.
Pre-cancerous. So the other ones did not have cancer in them yet. So Dr. Lucas already took those out.
Correct.
Yeah. So there aren't any more in there that are precancerous.
Not right now. But if you have a tendency to form polyps, more can grow. But
that's good to know.
But now that you're 80 years old, we're probably not going to worry about that too much. The main threat to you is this one that has become cancerous and has started to ulcerate and bleed and
It never bled till I took the medicine. Till I took the Eliquis, but it thinned the blood out so much.
It'll bleed more. It'll bleed without the Eliquis eventually. If it may probably it's bleeding right now, but it's not bleeding fast enough that you notice it.
Okay.
So
that's good to know.
So that's the scoop on that.
And how, so after deciding to go, if we decide to go forward with the treatment, how soon do you suggest to get started? And do we have some time to think or make a decision?
Yeah, you have some time to think.
6 years maybe?
No.
Doesn't have 6 years to
Right.
decide.
No, the decision's gonna get made for us here soon if we don't do something.
Yeah.
Yeah.
But we,
Okay.
but you can take a couple weeks to think on it certainly.
Right, but during that time, everything's still growing, and based on the
Slowly,
fact
but yeah.
that it's been only a year since it turned cancerous,
We're gonna go
I mean,
to-
cancer,
Yeah.
colon cancer is fairly slow growing in the grand scheme of things compared to other kinds of cancer.
okay,
But yeah, if we don't
Sure.
intervene, we're likely to get more bleeding and other problems starting to develop in the coming weeks and months.
okay.
The Chinese don't have any herbs for this?
I'm sure they do, but they don't really work all that well.
Going
Right.
off to profession again, ain't I?
No.
So
Doing
if
great.
you-
You're doing great.
If Chinese herbs could fix this, then I wouldn't even need to do this, which would be great. But
Yeah. Right.
So his next step would definitely be that next scan,
yep, and then
and
I
then
think
set up the radiation.
and then I think you should
Treatment.
see a radiation doctor.
And you could schedule all of that
Mhm.
if he chooses to do any of
Yeah.
that.
Yeah, and I think
That's
it's
good
it's probably
information. Yeah.
worthwhile to meet with the radiation doctor and then you can
Yeah.
ask some more of those questions,
Okay.
and they can talk to you about if they would do things differently, whether we're planning to move on to surgery afterwards or
Okay.
not.
You seem quite concerned about the smoking.
Oh,
Oh, just for the history.
we always ask.
You never
about that.
asked me one question about drinking.
Well,
About booze, no?
Yeah.
And I was just kind of curious
well, because
about your thinking on that.
yeah, because smoking
Right.
is it. Well, for one thing, I have to document smoking because that's one of these things that I get measured on, which is sort of annoying. But
Okay, that's interesting
smoking
to know.
does increase risk for all different kinds of cancers. Alcohol we see sometimes correlated with cancers, but much less frequently.
Okay.
If you were coming in here with
Destroy your liver.
That's right.
you can do that, yeah. If you were coming in here with esophagus cancer or liver cancer, I would be talking to you more about your drinking.
Yeah.
Okay.
I got you.
But right now we're interested in smoking because it causes cancer.
And
You're
heart,
confirmed in that.
lung
Mhm.
cancer.
Yes, there's no question about
They've
that.
proved that one, huh?
Okay.
Yes, that's established.
Mhm.
Causes a lot of different kinds of cancer.
Have you also learned that they changed tobacco in the cigarettes they used to smoke to ones they're smoking now?
I've heard things like that, yeah.
Quite a bit of change went into it, you know.
Yeah.
So the ones we smoked before weren't as bad as the ones we got
So
today.
you're
Is that
for
right?
the,
Okay.
you're for the tobacco industry. We don't have no stock in tobacco.
No, I'm just curious because you know they don't. You know,
Right.
they have all kinds of clinics for people to stop drinking, you know,
Oh yeah, oh alcohol.
but none to stop smoking.
What? Yes, they do.
Clinics, but they have lots of stuff to help people.
There's
stop
lots of
smoking.
programs.
Oh
Yeah.
God, yes.
exactly.
Oh, yeah. all
They're not
kinds
gonna.
Exactly.
of
They're
pills
not
and
gonna.
pipes
Right.
and-
Yeah, they're not
Yeah.
gonna put you in the hospital. You know, the reason
Okay.
they don't have to put you in the hospital to get you off smoking is that nobody dies from quitting smoking, but people who are trying to come off alcohol, they can have seizures
Oh,
and
Yeah.
delirium and all sorts
Oh
of crazy
wow,
stuff.
you're right.
Yeah.
That's true.
Yeah,
Different kind of an
quitting
addiction.
smoking is hard, but it's not gonna kill you.
Yeah, it's
Okay.
It's a different kind of an addiction. It
It
affects you
is.
differently.
Did you ever smoke?
No.
Yeah.
I mean, like 1 or 2 in high school or something,
Yeah.
you know, but it didn't work out too good.
Yeah.
It was always such a
We
have a-
social. Such a social.
She's a social smoker. She can
I
smoke a
don't
pack
smoke.
of cigarettes in a week, in a month, in 6 months, in a year.
I was not addicted.
She can start and stop
Yeah.
whenever she wants to. Isn't that something?
Yep. There's a lot of
I've
people
seen.
like that.
You seen people like that?
Yeah,
I've
there's
never
lots of
seen
people like that
before
that
in
can
my
smoke
life.
here and there,
Social.
and
Like
it's not.
having a drink now and then.
Yeah.
No.
Yeah, I think a lot of the
Okay.
addictive stuff is individual. You know, some people just have a real tendency to